I think that naming the problem so clearly and having so many people from different disciplines be able to discuss and be heard to clarify their perspectives, to realize that everybody agrees that symptom management in cancer is extremely important, but the how to improve the symptom management is the problem, especially in a limited budget. I found the way that the evidence was presented for the reading prior very useful. I thought that to have potential solutions given to us that were then properly discussed was probably more useful than the traditional brainstorming approach. I thought that the selection of the disciplines was also useful. It wasn't as siloed as it often is, which is one of the problems, and that's what maintains the issue of lack of integrated symptom management. I think that one of the most important things is that we're trying to impose a culture change and knowledge translation on a group of professionals who haven't necessarily been trained and raised with that knowledge. So I think that the first thing would be to ensure that more education and training is given, but also that we start now making sure that the different healthcare professions and the different disciplines start training their trainees right off the bat with a palliative and psychosocial approach. Because otherwise we're always going to be playing catch up. It's always going to be something that's top down unless we do that. I think that a multi-pronged approach right now is what we need, because it is a complex thing. It's not just simply a solution is not simply to stress screening it. If you don't have a response and you don't have the knowledge and the comfort level to be able to assess and manage symptoms, you're not going to get it done in a busy clinic. It's just going to be one of those things that is a should rather than a I will do this. We know from recent surveys that I think over 90% of the various healthcare professionals said that they thought that symptom screening was valuable. But I don't know exactly what the percentage was, but it was significantly lower. Let's say 60 to 70 to be generous, percent actually did respond to the symptoms and use the symptom screening. So I think that emotional and physical symptoms are not being routinely addressed in cancer management, but I think the very good news is that there's widespread knowledge that this is important and that we need to address it.